All right, well, good afternoon. I'm Amy Shuckley, Chair of the Tulare County Board of Supervisors, and on behalf of the residents of Tulare County, I'd like to welcome Mayor. Look at that, I just demoted you. I mean,
legit.
hey.
No, it's actually maybe a promotion.
It might be. Governor Gavin Newsom. Also here today with us is Mayor Osorio from the city of Delano. So thank you, Mayor, for also being here. Of course, we want to thank you and your administration for being in Tulare County, seeing what we're doing here in Tulare County. We've had a lot of success with our vaccination clinics, and as you saw today, we're continuing that success. We want to thank you for our increase in doses. You know, last week we received the email with the Excel spreadsheet, and Tulare County was 114% increase. I think some folks, we had to go pick up their eyeballs that were rolling down the aisle because, yeah, so thank you for that. And now, this week we'll be receiving a 40% increase on top of that, of course, to serve our hardest hit communities, such as here in Earlimart. It's so important to get that outreach out there, to reach the hardest hit and the disadvantaged who don't have the option of, you know, driving down the street in one of our other centers and receiving that vaccine. So it's so important. As you know, Tulare County is one of the top 3 ag-producing counties in the nation, and so to have our farm worker and our farm sources being protected, not only for themselves and their families, but to protect our food supply. So far in Tulare County, we have vaccinated 62,000 residents, which is about 12.8%, 32% of our educators, and the numbers are a little harder to decipher with our farm community, but it's about 5%. So obviously, we really need to up those numbers, and we're hoping that with the increase that is coming our way here in Earlimart and in Lindsay, that we'll start seeing those numbers increase also. So again, thank you for being here. And folks, let's welcome Governor Newsom.
Thank you. Thank you very much. Thank you, Madam Supervisor. And thank you for all your leadership and your hard work. And it's wonderful to be here with you, with other county leaders and your health officer. And of course, Mr. Mayor, thank you as well for your attendance. Look, I appreciate the supervisor's recognition that we were able to establish a commitment and actually deliver on it of 114% increase in the county in terms of new doses. And you're absolutely right, Madam Chair. We are going to see another increase this week as it relates to the efforts to do more and do better to reach out to underserved communities, communities that have been disproportionately impacted by this pandemic. We have to do more because we recognize that this state is not where we need to be in terms of reaching the issues and goals that we laid out around equity. The fact is, at the end of the day, it is a truism across not only this state, but across this country, that communities that have been hardest hit by this pandemic are also now under-resourced as it relates to the way to get out of this pandemic, and that's getting access to safe vaccines that will save people's lives. And while it's true California has administered more vaccines than any other state in this nation by a significant factor, over 10.6 million now doses have been administered in this state, we have to be mindful that those doses are not being equally distributed. And that's why our commitment here in the Valley hopefully is demonstrable, at least numerically. That it wasn't just a rhetorical commitment that we made a number of weeks ago, that we've truly delivered in terms of the promises that we made. That said, I want to make this crystal clear. Good enough never is. And I recognize we still have a lot more work to do. Our only constraint currently is manufactured supply. At the end of the day, we are administering as many or more doses than we receive on a weekly basis from the federal government. Only constraint now is supply. The question is, how do we make the scarce supply available to those most in need, most impacted? And that was the commitment we made last week to increase our efforts by providing a minimum of 40% of all our vaccines under an equity framework. 40% of all the vaccines committed to addressing the needs disproportionately, and let me just be explicit about this, to the Latino community. Not just the African American community, but substantively the Latino community. We recognize on that equity metric as well that it's not just an urban issue, it's a rural issue. And we have more responsibility to reach out to communities like this, incorporated and unincorporated, as we are in an unincorporated city in Tulare County. And so I'm here to highlight Supervisor's success, to thank her colleagues, to thank the entire county and their team for setting up now 45 locations just in this county alone to access these life-saving vaccines, to commit to more partnerships like the partnership here with OptumServe. There are now 12 OptumServe sites in the region that are operating, providing upwards of 210 doses on a daily basis. We are doing more and better to reach out and meet people where they are, not demand people come where we are. And one of the game-changing opportunities in that space is when J&J begins to be more plentiful in this state, we'll have a third vaccine option, not just the 2-dose regime, but the single-dose regime. And I'll just say this, if there's a vaccine I'm looking forward to when it comes, it's the J&J vaccine. That's just personal when it is my turn. But that single dose, one and you're done, will present itself as a third option very, very shortly. 320,000 J&J vaccines are arriving in California this week. We received just 21,000 last week, Northern California, Southern California, at 2 of the federal sites. They went there first. Now with the 320, we'll get them more appropriately distributed on a more equitable basis across the state. We're going to see supply increase significantly over the course of the next number of weeks. Light truly is bright at the end of this tunnel. We will announce tomorrow likely another dozen counties moving from the less or least restrictive tier. More and more progress every day as we're reopening our economy and reopening our schools safely for in-person public instruction. I made a commitment, and I'll just wrap up here, and we'll hear, of course, for any questions. I made a commitment to our educators, not just our teachers, but our educators, bus drivers, the cafeteria workers, our custodial staff, the support staff, the classified employees, not just our teachers, that if we're going to ask that we move much quicker to get our kids safely back into school, that we wanted to be there supporting that essential workforce in terms of making available the opportunity to be vaccinated. We had a goal last week. We announced that we could get 75,000 vaccines done in a week as a priority. Today, 1 week later, after announcing that last Monday, we can announce today that over 210,000 educators have been the beneficiary and have received a vaccine. 210,224 to be exact. So we significantly outperformed our minimum benchmark, and that should be great news for parents like me, parents like you, and others that are encouraged and encouraging our teachers to safely get back into school, to get our kids back that in-person instruction they so desperately need, not just for the academic, but the social and emotional benefits that in-person instruction provides. So really encouraged by that, encouraged by the progress, down to 2.1% positivity now in California. It's one of the lowest in the United States. Our case rate's down to 3,200. I mean, it was 53,000 6+ weeks ago, down to 3,200. Again, bright light at the end of this tunnel, making progress, moving in the right direction. But you're at the ground level. You're, at the end of the day, our vision and vaccines is realized at the local level. And so I just want to, again, end as I began with gratitude, respect, and appreciation for everyone in Tulare County for their great work and all the extraordinary people that are getting life-saving vaccines into their arms and allow them to go back, not just to work and feel safe, but to see their loved ones, see their kids and their grandkids, to hug again, and to celebrate all those wonderful milestones that make life worth living, getting back to whatever semblance of normalcy that we recall and remember, but with a vibrancy of having flexed our muscles and a resiliency that comes only after a year where our journey has been challenged by this global pandemic. So again, wonderful to be with you. Happy to take any questions.
Abigail Solis with the
Yeah.
Earlimart School District. So you mentioned our teachers. We get teachers that commute from the neighboring cities to come into work here at our school district. And obviously it's very important that we get them vaccinated. is there a way that we can better coordinate with our Tulare County Office of Ed so that teachers can just come to the site here by their school district where they work and get vaccinated here?
Yeah, we're provided on the platform for teachers. We're setting aside a minimum of 10% of all the new first dose vaccines that arrive in the state. In addition to that, we did teacher days in Northern and Southern California on Thursday and Friday. Those were additional vaccines made available exclusively for educators. But all of our educators can go to the My Turn app, or they can call 833-422-4255 and learn more about how they can connect to the provider network that includes OptumServe, where we are today, but also includes all of those other 44 points of access just in Tulare County alone, and over 3,000 throughout the state of California. So we're making that available to educators through the entire network, not just exclusive education days at large-scale sites. It's really trying to create equity and access across the spectrum.
Governor, you mentioned being able to hug again. Just want to get your reaction to the CDC's latest guidance that came out as far as vaccinated folks being able to gather without masks, without social distancing.
It is what we've all been waiting for. We've been waiting bated breath because, look, we're in a county, Tulare, to credit of, again, all the incredible leaders here, over half of your 65-year-olds at least have had first dose here in the county. In the state, it's 56% of all Californians in this state have received at least a single dose. Now, once you get the second dose and you have a 2-week period, the CDC is now saying you could take that mask off, you could go back home, or at least back to see your extended and immediate family members that you haven't hugged. But again, in smaller cohorts, no one be naive that we could just go back to our original form, but with caution and modifications. But it's incredibly good news. And it just shows the power and potency of these vaccines. Not only are they safe, not only are they effective, not only do they save lives, they change lives. Because the things we've lost, that connection, all this loneliness, can be absolved and addressed very immediately by taking advantage, once your turn comes up, to say yes to taking these vaccines.
Governor, I know we're in Tulare County today. We're just so close to Kern County, just 15 minutes north of Delano. When you and I spoke last week, you talked about your plan for the 400 zip codes in vulnerable areas. Can you touch on how that plan is going to get the vaccines to those areas? And here in Tulare, but also in Kern County, are you seeing results so far?
Yeah, we were in Arvin in Kern County with you a week or so ago, or I guess it was 2 weeks ago now, and we announced our efforts in the Central Valley to significantly increase doses on a weekly basis, but also provided that 34,000 doses one time to acknowledge some of the equity gaps. We also announced we were going to create 11 OptumServe sites. This is one of them now throughout the region. And so we've delivered on that. And now our commitment is to provide more with this 40% set aside to Kern County, to Tulare County, up and down the Central Valley to provide more coverage and overlay, because you're in what we call these hard-hit quartiles that we utilize data from zip codes. There's 1,650 zip codes that are part of this Healthy Place Index. And we really look granularly, and we look at communities based on 25 factors: socioeconomics, access to transportation, health care, cost of living, et cetera. And we provide an overlay, and that's this 40% overlay. And you are disproportionately a beneficiary in Kern County and Tulare County of that overlay. And that's why we have this subsequent increase, 114% last week in Tulare, and now another double-digit increase moving into the rest of the week.
I know that Tulare County was hopeful to have that Agri Center be a regional vaccination site. Any thoughts about that? Any progress or any consideration on that side?
Well, yeah, we're trying to work with local officials about what's right for you. We're not trying to do one size fits all. We talk about in-language, cultural competency. We talk about community vaccinations. It's really bottom up, not top down. So we're not trying to prescribe anything. We want a single platform, and that's this My Turn. So we can all have transparency, and we can all be accountable, and we can provide more payment incentives and drive distribution and administration, particularly when supplies start coming in abundance in the next few weeks. We have 2 large federally funded, federally sponsored vaccine sites. We were hoping to get one here in the Central Valley. We're still working hard with the Biden administration. Complete level setting truth. This is just the unvarnished truth. Other states, I'll be honest with you, were a little upset that California was the first to get not one, but two large-scale vaccination sites. And until the other states start to get more equitably their vaccination sites, we're struggling to get that third site here in the Valley. And so that's why I keep coming back, making the point, that's just one of many strategies. We're doing all kinds of other things to substantially make up for that and do even more than what that vaccination site would have ever done in the first place.
We're here in the fruit basket of the world. You talked a lot about vaccine equity today. What specifically is the state and the county, for that matter, doing to make sure these shots get in farm workers' arms? Is the state doing anything to track COVID and outbreaks among farm worker populations?
Yeah, very specifically. Two things we did in just the last week. We have now 337 community-based organizations that the state of California has contracted with. And these are all about trusted messengers. These are all about meeting people where they are. These are folks that are well respected within the communities where they have the ability to do things the state and the county cannot do. And so that's number one. So you have just in this direct area 12 community-based organizations we have contracted with in Tulare and serving the surrounding region. Number two, we also announced additional efforts to supplement and to do more as it relates, and I just noted it a moment ago as it relates to the equity, but a program called Housing for Harvest. And this is really an important program. We provided $24 million of additional support for Housing for Harvest. You're one of 15 counties that have been using the program. And the program is really important because it provides financial assistance and support for farm workers specifically, for their families, isolation, quarantine support, hotel vouchers, transportation. And that's a direct result of our efforts to try to reach out to farm worker communities specifically.
And Governor, I know it's here in the Valley today. Thank you for being here. Tomorrow, State of the State address.
Yes.
Can you give us any insights, any sneak peek as to what might
You wanna, let's do it. Let's preview it. Here it is, right here. I am working on it a little bit. I confess, a little bit on the drive down. So tomorrow, look, it's interesting. My last year's State of the State, interestingly, the entire State of the State was on the issue of homelessness, issues related to housing and mental health. And it was the first State of the State that ever set aside that as a topic. And we haven't lost sight of that issue. And I'll be talking a little bit about our efforts on homelessness tomorrow.